Well, good afternoon, and thank you for being here. We began a bipartisan investigation on the opioids epidemic more than almost a year ago, hoping to find answers as to how millions and millions of these deadly pills have been flooding into our states, and especially focused on the state of West Virginia. It's been ground zero for the worst abuses. We worked with the DEA at every turn, believing that we could be partners in this effort. We should be partners in this effort. But to our surprise and dismay, DEA has all but stonewalled our investigations. In fact, after months of delays, they promised to finally produce documents that we asked for. You know what we got back? We got back a lot of black ink. We want to know why they stopped or dramatically declined the use of the immediate suspension orders to get these pills out of our communities. In 2011, they had 65 ISOs, immediate suspension orders. By 2015, they were down to 5. And we want to know what it is that led the DEA to stop using this critically important tool. What was in their thinking? Why did they reach those conclusions? Because we're about getting the public policy right. And they have refused to share with us the information we need to do our jobs to get at this opioid epidemic. And so we're very frustrated. We have sent a clear signal to them that we are done waiting for their cooperation. This is a bipartisan investigation of the U.S. House of Representatives, the Oversight and Investigation Subcommittee. We stand shoulder to shoulder. My colleague Frank Pallone would be here with us and said to tell you all he would be here with us. He has a conflict and can't be, but we've had it with the DEA. And with that, I'd like to turn it over to the chairman of the Oversight and Investigation Subcommittee, Greg Harper.
Thank you, Mr. Chairman. I mean, this is not a difficult ask. We have an incredible crisis in this country on the opioids epidemic. And while we certainly have focused on what has happened, the inexplainable matters that have happened in the state of West Virginia, this is a nationwide problem that every state, every community is impacted. And we cannot do this on our own. DEA has to step up and cooperate with us and work with us on this. And this is just not acceptable. How are we going to solve these issues and these problems on a public policy if we're looking at that? And what we get are pages and pages that are blacked out. This is not helpful. DEA can do incredible work to help us get to the bottom of this, and it's time. It's time for them to do that. And I appreciate the fact that this is indeed a bipartisan effort. It's actually a nonpartisan effort. It controls every aspect. I don't know of too many families that haven't been impacted by this type of problem. So we just urge the DEA to stop playing games here. Step up and let's solve this problem and work together. Thank you.
Thanks. I'm Diana DeGette. I'm the ranking Democrat on the Oversight and Investigation Subcommittee and been involved with this investigation since the earliest stages. As the chairman said, we're investigating the causes of the opioid epidemic in West Virginia, which has the nation's highest rate of opioid overdoses. We have found a lot of disturbing information in this investigation, including 20 million opioids sent to a town of approximately 3,000 people in West Virginia. And so we need to understand whether the key systems that were designed to prevent these illegal diversion of opioids broke down at the distributor level and with law enforcement. We can't do that without the cooperation of the DEA. And we have, our committee leadership has now met with the highest ranking officials in the DEA 2 times to explain that to them and to explain to them why we need these critical documents so that we can continue our investigation and, as the chairman said, enact appropriate public policy. The DEA simply refuses to cooperate. They've given us some information, but as you've seen, this is not going to be helpful to us in trying to figure out where we go from here. So I joined my colleagues, again, on both sides of the aisle to say, we can be partners in this, and we should be partners in this, because the health of Americans is at stake. Thank you.
Thank you. My name is David McKinley from West Virginia. This issue is just absolutely, I know it's being overused, it's just ravaging West Virginia. We have a drug overdose rate, death rate of 52 per 100,000. That's 3 times the national average. We've been working with the committee to try to understand what's the cause, what's the root cause, because we can deal with the one end of it, but how do we get back to the root cause of it? Is it economics? Is it education level? There are a lot of things we have to work with, need to find out, and we're not getting the cooperation from the DEA. But in West Virginia, we're ranked the #1 in the country in overdoses. And some will say it's because your economic plight. You're 48th in unemployment, and your household income is in the 40s. I can understand. Maybe that could be used. But what we want to do is pursue further, because the contrast is, how about the state that has the second highest rate of employment, and the third highest household income? That's New Hampshire. New Hampshire is the second worst in the country. We need to understand there's obviously more factors than your economic situation. It's crossing all socioeconomic borders on this to find out the contrast between the two. So what we're pushing, and we tried this morning, we had a meeting with FDA and SAMHSA and HHS. What we want, but DEA was a no-show, because we wanted to find out, how are we going to send a message of accountability? How are we going to find out all across the country how many people are being prosecuted? I was on a town hall discussion last night, and that's what people were calling in. They said, we don't know what you're doing. We don't know. We're not seeing people arrested. They're being held accountable for poisoning our children. And one fella, he had lost his son. And so it was a very personal attack with that. What are we doing? So in West Virginia, we can show that just in the last couple of years, we now have 8 people, 8 doctors have lost their license. We have 7 pharmacies have lost their license as well. We have some numbers of suits that have caught about $46 to $50 million has been collected from pharmaceuticals. That type of information, the DEA has more all across the country. How can we collect all that to find out and send this message to the American public that Congress is acting, but we're having trouble getting information to complete that. And this is just another record of what it is. This is in War, West Virginia, a population of 808 people. But yet the pharmacy sent 800,000 oxycodone into that community in the last 2 years. So if nothing else, for all of you, this is what we need to be reading more, is to understand this is called American pain. This goes back to the genesis of the problem with the opioids across this country. And it was written in many respects for my office. We use this as a textbook, because here it talks about how we should be dealing with it in Washington, but we're not getting the cooperation. And the other is Dreamland. Many of you hopefully have had a chance to read that. Those are 2 powerful reference books that all of us should be reading to understand how this is caused, and then how are we going to go about doing it. But we need the cooperation of the DEA. So again, this information of blacked out papers, they don't work anymore. This is killing our children. It's devastating families. We have a responsibility in Congress to try to pick up this and solve it. So thank you all for your help on this. God bless all of you.